Today's webinar will be a R3c live event. We'll be discussing mental health in the workplace, just like the title states. But if you have any questions throughout the whole webinar that come up, please feel free to ask them in the Q&A widget, and we'll address those questions if there is time at the end. Our subject matter expert today is R3 Continuum Associate Medical Director, Dr. Tyler Arvig. Dr. Arvig has over 13 years of domestic and international experience in behavioral health workplace absence, including disability and workers' compensation assessment, consultation with employers and insurers on complex claims, effective return to work strategies, program development and improvement, as well as supervision and training of industry professionals. He's a sought-after speaker, writer, and contributor in the field of workplace behavioral health and workplace trauma recovery. So, Dr. Arvig, thank you for being with us here today. I know we have a lot to cover in the 30 minutes or so here. So why don't we start it off by just talking about kind of mental health and where we're at right now?
Sure. Thank you, Shane, and thanks everyone for joining us. Like you mentioned, we only have about half an hour here, and some of the information we're going to talk through and present might seem repetitive. Maybe it seems like stuff that you already know to some extent. But as we're going through this, I want you to think about how does this apply to me and the people in my life? I mean, really, main focus of this webinar is how do I support the people that I work with? And part of that is also supporting yourself and recognizing things in yourself. So as we're going through this, don't think about this content of this is stuff that's being presented to me. Think about it of how does this apply to me? How have I noticed this in my own life with my coworkers? So I wanted to start off our talk here today with something that happened to me last week. I was doing an on-site response for a disruptive event where there was an individual who was attacked, and I was supporting the employees who had witnessed and experienced the attack. And in this presentation, or in this, not presentation, but in this meeting, a gentleman who looked about the size of an NFL player, we were talking about some of this mental health stuff, and he goes, and I made the title in my slide politically correct, but he goes, you know, this mental health stuff, this shit is real. And I'm like, yes, it very much is real. And he had a bit of an awakening because it affected him. And it was previously something that was happening to other people, but not him. But this experience made it real to him. And honestly, just him saying that was a huge, everyone else benefited from that in that group, because it was an understanding that this isn't just happening to everyone else. It's happening to me. It's happening to people I care about. So we'll hear things, recently like, I've never felt like this before. I don't know what to do with this, those kind of things. And while many of us might have experienced challenges in our mental health, or we all know people, if it's not ourselves personally, we all have people in our families, our friends that are experiencing struggles, but it seems like right now it's hitting closer to home for a lot of folks than it has in the past. And obviously this shows up in the workplace, right? Our coworkers are people that we spend an awful lot of time with, in many cases, more time than we do with our spouses or our families or our kids. And so it's really important that we have an awareness of, how do we support those around us? These people that are important to not only the functioning of the organization that we work for, but they're also our personal connections, our friends, people that we care about.
Yeah, I think that's a great point. I think that example is while it is funny, it's very real. I think that the last 2 years have really shown a lot of people that mental health support and kind of mental health is a real thing. It's not just you heard about it on the news and everything like that, but it is definitely a very real thing, and it's affected a lot of people the last few years. So going forward, can you kind of, I think just dive into this slide about how to start this out, what you should do for supporting mental health?
Sure. I'm going to start this with with you, with us. So instead of looking at other folks, I want to start this with how do we look at our own health? Because this adage, you can't save someone from drowning if you're treading water, is true, right? If I'm struggling, I can barely keep it together for myself. I certainly can't support in a meaningful way others around me. It's just I don't have the resources and the capacity to do that. So caring for yourself has to be a priority. And this doesn't necessarily mean I need to do yoga every day, or I need to meditate, or I need to journal, although some of those things are helpful for a lot of people. And I would encourage you to do those things if they're part of what helps you to care for yourself. But also other things, if you know what, that 1 hour of trashy TV is what helps you to unwind and do a little self-care, great. Whatever it happens to be for you. But we can't support other people if we're not being adequately supported ourselves. So I want you to think through a little bit. What am I seeing in my own life? And I shouldn't say I'm amazed, because I'm not, but I hear a lot of people and I talk with a lot of people around, they're doing things that they wouldn't normally do. They're snappy in situations they wouldn't normally be snappy, or they're irritable, or they get angry and they don't know why. And a lot of that is, us struggling, and those struggles coming out in our daily lives. But maybe we just don't have that awareness of, why did I just, snap at my child over something that was pretty minor? Well, maybe because I'm stressed, or maybe because I'm struggling with something else and it's coming out that way. So we need to care for ourselves. We need to be mindful of what we're seeing in our own lives. We can often, and psychologists are better at this than anyone, we're good at identifying problems and issues with other people, but we're maybe not so good at identifying those things in our own life. Right? I can tell you when someone else is acting bizarre, but when I do it, I don't have an awareness of it. So, what am I noticing? Maybe what feedback am I getting from other people, and what does that mean? And then figuring out really, what do I need help with? And we're going to talk through some of that as well, of, if I need some additional help, how do I get it? But I want to go back to the title of this slide. You can't save someone from drowning if you're treading water. And that's true. But one thing I want us to be aware of here is the goal is not to save someone else from drowning. The goal is to support them. In addiction, for anyone that's familiar with AA or NA, Alcoholics Anonymous, Narcotics Anonymous, any of those types of support groups, it's not a person at the top who is saving other folks. It's not one person who is providing the treatment or the intervention for the affected individual. It's a group of people that band together to support each other. Okay. And so, yes, it is true, I can't save someone from drowning if I'm treading water. But it is equally true that two people that are treading water can support each other, right? So it's not about being the savior. It's not about being the intervener, but it's about supporting each other. One of the, it would have been a unique circumstance, but now 2 years in, it doesn't seem like that unique, is that we're all in the same boat when it comes to the stressors and the things that we might be feeling. Doesn't mean everyone's going through the same thing, but at this point, everyone understands the COVID situation and everything else that's going on is producing stress and disruption for everyone, even if it's at different levels. So we're not looking to save someone, but we're looking to support each other in this process.
Yeah, I think, excuse me, I think that's an excellent point. And I know if some of you were on our webinar last week, I mentioned this, but last month's webinar, we asked, it was more focused on stress and burnout. But one of the questions in our registration was about, are you feeling more stressed now than you were in the past, or something around that. But it was 60% were strong yes. And I believe it was 35% were yes. So it's everybody is being impacted by this, and it's a really interesting way to show that, we all kind of have to deal with it, whether, it could be maybe they were answering that question and they were just stressed about work that week or something. But like you said, everybody kind of deals with it in their own ways, and it's important to kind of realize that for yourself. So going on to that, can you kind of talk to us about like different ways or signs that you could see if somebody is maybe struggling a little bit more than usual?
Sure, I will, Shane, but I just want to go back on something you mentioned earlier, because Shane and I done a webinar a couple of months back, and it was about, we polled people on what the biggest fears or concerns were at the time. And it was at a time when the COVID numbers were trending upward, and as they continue to be. And I expected to see most people's concerns around, physical danger, right? About contracting the virus and all that kind of stuff. The interesting thing is, that was certainly one of the significant concerns, but the bigger concern was what we're talking about here, is the mental stress piece of it. That was a bigger area of concern for folks. Even in light of physical realities that are rightfully so, big concerns for people, these were actually bigger concerns. So I want to talk through, how to use your power of observation. So I'm a psychologist, and you might know some other physicians or psychologists or people, but the reality is we all have our own like mini doctor inside of us, right? We all have the power of observation. And a lot of what we do in our world in mental health is observe things, right? We notice things, and we observe things, and then we try and put those things together and make sense of what it means. We all have that power. And the first slide here is really self-focused. So this is, what am I noticing? And again, this applies to other folks in your lives too, but really I want for this slide to think about, what am I noticing in myself? What are some signs that I might be struggling with a mental health concern? And again, you might look at these and go, this is stupid. I've seen this a million different places, and this is nothing phenomenal. But I really want you, as we're talking through these, to think about your own life. Don't just read them and make note of them, but think about, have I experienced this? What situations might have I experienced this in? What does it mean? So changes in mood, obviously. And there's differences between men and women when it comes to, for example, the expression of major depressive disorder. Women tend in depression to experience more of that emotional sadness and tearfulness. In men, that can also be the case, but it also can come out as anger or irritability. But changes in mood that are not, it's not that someone just died and you're sad, but it's a change in mood that you really can't point to maybe a cause, or maybe it should have lasted half an hour, but it's been 3 days, kind of thing. Difficulty getting stuff done is a big one. At work, at home, if you find yourself struggling to get tasks done, you find yourself struggling to get basic things done around the house, you're falling behind on things. That's often a sign of other struggles that you might need some help with. Irritability, like I mentioned, particularly in men, but also in women. What is that telling you? Are you getting irritable over things that are that you normally wouldn't? Or are these things that, we all get irritable about some things that are legitimate things, right? But are you getting irritable about something that's relatively minor? Are you experiencing more negative thoughts? And this is one that I think a lot of us have struggled with over the past couple of years, because there's so much negativity in when you watch the news or social media or what have you. But if you find yourself having more negative thoughts about life in general, or about your life situation, or work, or those kind of things, are you experiencing strain in your interpersonal relationships? With spouses, with children, with parents. Now, I think we've all experienced some level of strain in interpersonal relationships given the significant external factors. But if they're not getting better, if they feel like, the hole's getting dug deeper, that's also something that's often where mental health challenges show up for a lot of folks first, is when they really are struggling with getting along with other people. Concentration problems. Again, it kind of goes along with difficulty getting stuff done. But do you find yourself struggling with things that used to be easy? Is a simple task taking longer than normal? Those kind of things. Changes in sleep. Either sleeping too much, or not being able to fall asleep, or not being able to stay asleep. Thoughts of death and dying. I mean, this is obviously a pretty significant one. For obvious reasons. If you find yourself having suicidal thoughts, or even passive thoughts about, I wish I wasn't here, or what if I wasn't here, those kind of things. Certainly, if you're having those kind of thoughts, you want to reach out and get help. Ideally before those, thoughts become more significant, or before you have intentions of acting. But honestly, especially when it comes to, thoughts of suicide, or thoughts of death and dying, most people at some point in their life have experienced these kind of thoughts. It's something that, again, most people at some point break up a relationship, or whatever it happens to be. But that's something that we want to take very seriously. There's lots of resources, and I think toward the end of this, there's a resource specifically if you're having thoughts of hurting yourself. But be very mindful of that. If those thoughts are starting to come in, that's something you want to try and address. If you're experiencing an increase in your use of alcohol, there are other substances, caffeine, nicotine, THC, marijuana, those kind of things. We can often do those things to try and mask other feelings that we might be having. And most of the time, those things actually compound the difficulties we're having in the first place. And then the last point here is really hopelessness. If you find yourself feeling hopeless about your situation in life, or where things are at, I mean, that's something that's obviously probably pretty indicative that you might need some additional help. There might be something else you'd want to address.
Yeah, I think those are all, obviously very powerful things to be observing and to be watching, and especially, for yourself, but also other people around you. So going forward, supporting kind of coworkers or those people around you, can you kind of dig into what you can maybe do if you see those signs elsewhere?
Yeah, absolutely. And again, these might not seem all that, insightful or particularly, earth-shattering. But what I find and what we found is we forget to do these things. We don't consciously think about doing these things, and they're really important for supporting those around us, including how others around us support ourselves, right? So when it comes to coworkers, stay in touch. I mean, really, it sounds basic, but you got to do it. And it can't just be about work stuff all the time. If you find yourself like, I'm working from home, Shane's working from home, many of us are these days. But if you find yourself going through most of a day and you haven't talked to someone else, it's probably not a good thing. So do stay in touch. Work or not work, staying in touch is staying in touch. But make those conscious efforts. If you have to put something on your darn calendar to remind yourself to do it, do it. And then when it comes to reaching out to others, and let's say you have someone that you're concerned about, Shane is exhibiting some things, and I'm a little bit worried about Shane. Ask questions, but ask non-invasive ones. Again, your job is not to be the coach. Your job is not to be the solver of all problems, but your job is to be a support. How are things going? Are you doing okay? And maybe you, and this goes into the next point here, but oftentimes you lead those questions with sharing some of your own experience. So let's say you have a coworker who you have a sense is maybe struggling with multiple demands and, managing their kids and work. And I go, I got to tell you, in my house, it's been hard. This happened and that happened. And this morning I had to bring my son to school late because they got back on a super late flight and it was in the middle of work. So I had to figure that out. But leading with something that shares a little bit about what you're experiencing and then asking them oftentimes helps them to open the door to share what they might be struggling with. And again, though these questions are not going to be invasive. You're still a coworker, right? I'm not going to ask clinical questions. I'm not going to ask really invasive questions, but basic ones. How are you doing? And not like, how are you doing like we do in Minnesota, where it's just kind of the standard greeting, but you don't really want an answer. Like if I asked Jane, how are you doing? And you actually gave me the answer, like, I'm not doing very good, I'd be surprised. But I mean, really, how's it going? Seriously, take that time to hear what they have to say and to support them. When it comes to those connections, also make time to connect outside of work tasks. Now that vaccinations are more widespread, some people are going out more. Maybe you can meet someone for coffee if they live where you live. But even if you can't, pick up the phone after hours. Maybe you do some kind of virtual happy hour thing. Nobody wants to, work when they're off the clock, but connecting outside of things like, how's this project going, is really important. Before this webinar, Shane and I talked for 20 minutes about car stuff, because we used to do that all the time when we were in the office right down the hall, and we don't get to do that anymore. But that kind of stuff is really important. It helps us to maintain those connections, not just to get work done, but to feel like we're part of something. Share the resources that you're aware of. I think we've all gotten pretty good these days at figuring out what resources are available. Make sure you share them, what those are, with other people. If they're struggling with, like, gosh, where do I go to find a doctor that can maybe help me with medication if I need it? Or how do I find a therapist? If you know something, share it. Last points here, I'll go quick because I know we're running short on time, but just show that you care. It really is pretty basic, but even a question that's not a great question, but if it's delivered with empathy and with genuine concern, it's going to land well. And then for folks that might be struggling more and they not knowing what to do, if you know how to get them connected with someone in HR or someone in the company that can help, do it. Just a couple quick things here. Be mindful of all of this. You're not taking responsibility for someone's safety or care. Maintain boundaries as appropriate and keep information private. If you're going to ask and share with other people, keep that confidential. All right, we can move on, Shane.
Perfect. And I mean, I'm not a psychologist or anything, but I do want to mention, I was actually going to talk about how we just discussed, cars before this call. We both hopped on a call and said, this is the most Monday Tuesday, like the most Monday feeling Tuesday ever. And just in a conversation about cars, we're not talking about work for a few minutes. It really changed kind of like, I feel like my mood, I got like more just a little out of the work mindset and was just connected. And the communication is just that I could see it right then and there. Yeah. So we have had a few comments in our question and answer too, just kind of looking for more resources or questions on staying motivated when you're trying to change to do better. And I think this is a great slide to kind of go into that. So with our last few minutes, why don't you dive into kind of the resources?
Absolutely. Well, first, I mean, just general things. Psychotherapy is a resource that everyone can benefit from. There's nobody in the world that wouldn't benefit from some psychotherapy. But if you're struggling, reach out for it. If you have your private health insurance, great. Most of it now is done just how we're doing this meeting. You can do in person, but you can also do virtual, which means you can probably squeeze it in on your lunch break if you have to, and no one's going to know the difference. Use apps. We all use apps for different things, but there's apps that are helpful out there for things like how do I, meditation apps or mindfulness apps or anxiety management apps. They're out there. Use them. Support groups are available. We talked about like AA and NA and those kind of things, but support groups are great resources. They don't cost anything, but it's people that might be in a similar boat than you are and can be helpful. Heck, if there could be parent support groups that that you would find beneficial. There could be anxiety support groups. There can be weight loss support groups. And again, most of them are available virtually. And then, clearly, if you're struggling with more serious concerns, don't be shy about, going to the hospital if you need to. I know this is kind of a hard left turn here, but I can't emphasize it enough. If you're struggling with severe depression and severe anxiety or suicidal thoughts, and there's a lot of people that are right now, get the help you need when you need it. And don't be afraid to do that. There's a suicide prevention phone number right there. There's also a website, and use it certainly if you need it, or if you have someone in your life that you think needs it, use it. It's there for a reason. In terms of work resources, most of you probably have an employee assistance program. I'm guessing most of you also have never used your employee assistance program, but those programs are there for your benefit. They're a no-cost benefit, and they provide a lot of different things, including, in many cases, no cost, a brief course of no-cost psychotherapy. So if you're struggling with something that's, how do I manage this? They might be able to hook you up with a provider for 3 or 5 or 7 sessions at zero cost to you. Use it. It's there. Absolutely. And then also, stay in touch with human resources, as many of them have gotten creative about putting wellness programs in place or other resources in place. Use those resources. They're there for a reason. And they're quite helpful. So that is all that we have here. Shane, do we have any other questions?
Yeah, we do have a few questions. I have a perfect one that's actually going to follow up from that last slide. While we have everybody here, I know we have just about a minute left, but I do just want to invite everybody to our next webinar on Tuesday, November 30th. That will be titled Reclaiming the Magic, Resilient Strategies for the Holiday Season. Our presenter for that will be R3 Continuum's Vice President of Crisis Response Clinical Services, Jeff Gorder. If you'd like more information or to learn more or register for that, you can click the register tab or the resource widget, and you'll be able to get more information there. But with the last few seconds we have here, Dr. Arvig, I think a really good question that is really important is, how do you know when you should reach out and seek a professional?
Good question. If you're having thoughts about doing it, you probably need to do it. What I would suggest is, if you find yourself struggling and it's not getting better, if you find yourself making the same mistakes or, having the same issues and it's not changing, an easy way to start the ball rolling is to go see your primary care doctor or go just talk to someone. Consult with a professional if you're wondering, and if they have solutions for you that don't mean treatment, then great. But a lot of people, when they struggle and they don't know what to do, their natural reaction is to do nothing, and that can actually make things worse. So, great question. Also, if you have an EAP, use it. That you can call and talk to someone, and they can give you guidance on what resources might be helpful for you.
Fantastic. That will do it for us today.